So, what's the deal with the public health system in the Philippines? Let's break it down for everyone. For those who are wondering, it sucks to be sick. No duh, right? Well, let me rephrase. It sucks to not have enough money to access private hospitals because the public health system in the Philippines has many, many, many flaws, and those who have to make use of it don't get proper medical attention, which results in a myriad of problems. A lot to take in, right? Now, it may seem like it's only a problem for those who are sick and can't afford good treatment, but you also got your doctors, your hospitals, and even your government. And this all leads to one big giant mess that is the public health system in the Philippines. Now, the lack of access has many roots and causes, but really it all boils down to the lack of facilities. Well, I mean the lack of good facilities. I mean, in the Philippines, we definitely have public hospitals, which may seem well and good, but it isn't. For one thing, they're really dirty, and I mean really dirty. Now, not only that, but there are way too many people in these things. And because there are too many of them, well, they don't exactly get the attention they need. And they'll resort to other means, which I'll get to in a moment. Now, there's also the issue of becoming a public doctor. For one thing, it's already pretty tough to study medicine, so that takes people right off the bat. Then, of course, there's the issue of which of these people actually become doctors. So let's shave off a few more people. Now, let's think about all those who would become doctors in private hospitals because the pay and the working conditions are much better. There we go. Oh, but let's not forget those who leave because the pay and working conditions suck. There's our superstar right there. Unfortunately, this one man or woman would have to deal with their low wages and the poor working conditions, not forgetting the tons of people they'd have to deal with. And, well, that could make them a little cranky, or, well, maybe very cranky. This means that their patients will either get a diagnosis that might not be 100% correct, or they could actually just get maltreated. Either way, it's not going to be very pretty. Remember when I said people resort to other means if they don't get treated properly? Well, these means are usually your local witch doctor. There are tons and tons and tons of news reports about people who swarm to witch doctors because they couldn't afford better treatment. Now, these doctors aren't exactly qualified, so it's not like people feel much better after treatment. If anything, they feel worse, which just makes the situation at hand even more dire. So you may be wondering, what's the deal? Why don't they just get the money to fund public hospitals? Then this absolute nightmare of a situation can be over. Well, there lies the root of our problem. There is no priority. We pay lots of money in taxes and, well, I think you get the point. But it doesn't feel like much of it goes to the development of public hospitals at all. I mean, more of them get built, but we don't really have the capacity to maintain what we already have. What more, something new? Basically, we're just adding more problems. So, to recap, the public health system in the Philippines sucks for a number of reasons, but the main reason is people who don't have enough money for private hospitals can't access good medical attention, and as a result, don't get any better. There's also the issue of overcrowding and cranky doctors and dirty facilities, which all lead up to patients who don't get any better. So, yeah, that sucks.